Hello everyone, this is Shubham and today I will be talking about the nose. Basically in this video is about the cavities of the nose and the sinuses of the nose. How many kinds of sinuses we have in the nasal cavity or around the nasal cavity, and what can be the complications when the sinuses gets inflamed. Okay, for example frontal sinusitis or the ethmoidal sinusitis, etc. So after that, I will talk about the blood supply of the nose, that which arteries are supplying the blood in our nasal cavity or in our nose. And after that, I will be talking about the diseases related to the blood supply of the nasal cavity, right? So let's talk about the anatomy of the nose little bit, and then I will go into the detail of the nasal cavities, right? So here if you will look at this diagram, right? For example, this is some person. For example, this is the eye, right? Just for the orientation purpose. Now, here is the nasal cavity, for example, right? And here is the mouth and something like this, right? So basically this is the nasal cavity, right? This is the nose. Now you must be knowing that here is the nostrils, that we have the nostrils. Actually we have in the nasal part we have two main parts of the nose, right? We have the respiratory part and the olfactory part. Olfactory part helps in the sense of smell, right? And the respiratory part helps us in breathing. For example, inhaling the oxygen and exhaling out the carbon dioxide gas, right? So here I'm not talking about the histology of the nose in this video. I will just talk about the cavities and the sinuses. And right now I'm going to talk about the nasal cavities and the some anatomy of the nose. So here this portion will be the pharynx, right? Pharynx, we have three parts: oropharynx, right, nasopharynx and the laryngopharynx. So this part is going to be the oropharynx, nasopharynx and the laryngopharynx, right? Then further we have divisions, like one will go into the trachea, which is the respiratory part, right? And one will go into the esophagus, right, through which we swallow our food. So now here in the nasal cavity, there are the depressions like this. And by the way, this is the hard palate, you can say, made up of bone. So this is the hard palate, right? So this is the hard palate, and this portion is the soft palate, right? We have the hard palate and the soft palate, right? More anteriorly we have the hard palate and more posteriorly we have the soft palate, right? So hard palate is made up of bone and the soft palate is more posteriorly after the hard palate, right? Then if you will talk about the sinuses, we have the frontal sinus over here, and over here we should have the sphenoid sinus, right? We have the ethmoidal sinus also, but I can't show you in the later part because right now I have drawn the diagram with the lateral view. So you are looking at me like this. So this is the lateral view I have drawn over here. When I will draw the frontal view, you can see the ethmoidal sinus too, right? So this is the frontal sinus, this is the sphenoid sinus, right, in the center. So here would be our frontal sinus, right? Inside we will have the sphenoid sinus, right? And here we will have the ethmoidal sinus, right? Whenever we are suffering from rhinitis, right, or some kind of viral infection, right? So we can check about these sinuses, because these sinuses can be filled with the mucus, right? So if we will palpate these parts, like frontal sinuses or the ethmoidal sinuses, right, there will be the pain, right? If there is pain, that means there is the inflammation of these sinuses. There is the sinusitis, for example, frontal sinusitis or the ethmoidal sinusitis, right? So in case of viral infections, this is more common that inflammation of sinuses can occur. For example, frontal or ethmoidal sinuses, or in some cases, the spinal sinuses. Further, they have their further complications too. However, they are rare, but those complications have been seen, right? So this was the sphenoid sinus, and this is the frontal sinus over here, frontal sinus, right? And these three depressions which are drawn over here, these are the superior nasal concave. We have three kinds of nasal concave present in our nasal cavity: superior nasal concave, middle nasal concave, and the inferior nasal concave, right? Behind these concave we have the meatus. Like behind the superior nasal concave we have the superior nasal meatus, behind the middle nasal concave we have the middle nasal meatus, and the inferior nasal concave, behind it we have the inferior nasal meatus, right? So for example, superior nasal concave will drain into the superior nasal meatus. Likewise, middle nasal concave will drain into the middle nasal meatus, and inferior one into the inferior nasal meatus, right? So if I will draw the superior nasal concave over here, middle here, and the inferior here, so just to show the middle, superior and inferior nasal meatus, they will present like this, right? Okay, so they were the superior nasal meatus, middle nasal meatus, inferior nasal meatus, right? And above them we have the superior nasal concave, middle nasal concave, and the inferior nasal concave, right? So this was the frontal sinus, this was the sphenoid sinus. In some cases of viral infections, just I have told you like that in cases of the viral infections, right? For example, in case of rhinitis, or we call it as coryza, right? So this is the inflammation of nose. Why we call it inflammation of nose? Because actually there is the inflammation in these sinuses, frontal sinuses, right? At sphenoid sinuses, we have also the ethmoidal sinuses, right? If we see the frontal view, I will try to draw the frontal view, the very approximate. For example, these are our orbit, right? So, right, and for example, these are the teeth, right? So these are the orbit. This is the orbit. Just to orient. This is the anterior view. Now you are looking at me like this, right? And this was the lateral view. You are looking at me like this, right? So this is the orbit. Now this one, this is the ethmoidal, right? Sorry, this is the frontal sinus, This is the ethmoidal sinus. Ethmoidal sinus, and this will be the sphenoid. Sphenoid sinus, right? So ethmoidal sinus, you can see that approximate is present over here, right? And the sphenoid sinus is present in the center, right? In the center of a skull, because the sphenoid bone is also present in the center of the skull. So, so this is the anterior view, right? I have drawn the superior, middle, and inferior nasal concave. In between them, we have the superior, middle, and nasal concave, and behind that we have the superior nasal meatus, in middle nasal meatus, and the inferior nasal meatus. Here I don't have a space, so I can't draw the superior nasal concave, but they are present over here in between, like something like this. Okay. So for example, these are the superior, middle, and inferior nasal concave, and behind that we have the superior, middle, and inferior nasal meatus. So frontal and ethmoidal sinuses, right? They drain into the superior and middle nasal meatus, and the sphenoid one will drain into the inferior nasal meatus, right? Now, if we have the inflammation in the frontal sinus, right? What can be the complications of the inflammation of the frontal sinus or frontal sinusitis, right? So in case of frontal sinusitis, however, these complications are very rare, right? But in some patients, it has been seen that the patient with the frontal sinusitis, they can have the meningitis, right? Because here we have the brain, right? For example, let me rub the eye. So here we have the brain, right? Here will be the cerebellum, for example, right? The posterior part. So here is our brain, right? So these frontal sinus, when they will be inflamed, right? When they will be inflamed, right? They can harm the meninges, right? Meninges of the brain, right? Because meninges, you know, the layers of the brain. For example, from the outer side we have the dura mater, right? Then we have the pia mater, arachnoid mater, like this, right? So it can invade into the brain. It can invade the meninges in the brain and can cause the inflammation of the meninges, right? So this is the frontal sinus, and this is the brain, right? This is the brain. So whenever it will be inflamed, the meninges can also be inflamed, right? So this can be the complication of the inflammation of the frontal sinus or sinusitis, frontal sinusitis, right? Likewise, in the ethmoid sinus, we can also have the complications, right? In the ethmoidal sinusitis, we can also have the complications. It can cause if it will inflame, right? It can cause the damage to the eye. For example, this person can suffer from the blindness also, and even in some worst conditions, optic neuritis, right? And various other kinds of eye diseases can occur, right? However, these are very rare. So we have seen the nasal cavity, we have seen the sinuses, what can happen when there will be the inflammation of the sinuses, for example, the frontal sinuses or ethmoidal sinuses, right? Likewise, we can have the complication with the sphenoidal sinuses too. Now we will look over the blood supply of the nasal cavity, right? So let me rub this portion and let me draw the blood supply. So if we will talk about the blood supply, it will come from the ophthalmic artery. So the origin is the ophthalmic artery actually. For example, this is the ophthalmic artery over here, right? So Here is the ophthalmic artery, right? From here we have the branch. So this was the ophthalmic artery, this is the internal carotid artery. So let me name them. That this is the ophthalmic artery, this is the ophthalmic artery, and this is the internal carotid artery. Internal carotid artery, right? Internal carotid artery. Now internal carotid artery will move further and will give further more branches, right? Like we have the posterior ethmoidal artery, we have the anterior ethmoidal artery, right? And we also have the sphenopalatine artery, then we have the greater palatine artery, right? Then we also have the superior labium artery, right? So let me name them for you. That this will be the posterior ethmoidal artery. This was the anterior ethmoidal artery. Anterior ethmoidal artery. So these two arteries, posterior ethmoidal artery and the anterior ethmoidal artery, they are coming from the internal carotid artery. And internal carotid artery was coming from the ophthalmic artery. But these two arteries, which is the sphenopalatine artery and the greater palatine artery, right? These two arteries are branches of maxillary artery. They are not branches of the internal carotid artery, right? So the sphenopalatine artery and the greater palatine artery, these are the branches of the maxillary artery, right? They are the continuation of the maxillary artery, because here we have the maxilla, right? And here, this is the superior labium artery, and this is the continuation of the which artery? This is not the continuation of the maxillary artery, this is the continuation of the facial artery, right? So internal carotid artery gives out the branches, posterior ethmoidal artery and the anterior ethmoidal artery, right? Then maxillary artery gives out the continuation to the sphenopalatine artery and the greater palatine artery, and the superior labium artery is the continuation of the facial artery, right? Now they will make a special kind of circle over here, right? So they will make a circle over here, right? And this is very important. This circle is very important in the nasal cavity. This circle is made up of the posterior ethmoidal artery, anterior ethmoidal artery, sphenopalatine artery, greater palatine artery, and the superior labium artery, right? This is the blood supply, and this blood supply is making the circle-like formation, and this circle is also called as the Little's area, or the Kesselbach area. So this area is also called as the Little area or Kesselbach area. Kesselbach area. And this is very important. You must have heard about the epistaxis. Epistaxis, what is epistaxis? Epistaxis is also called as the nose bleeding. Epistaxis, right? So this is also called as the bleeding from the nose, nosebleed, right? Nose bleeding, epistaxis. Now, in the nose bleeding, what happens? That there is the vasodilation, because this nose bleeding, you must have heard about the nose bleeding. The patient is suffering from the nose bleeding epistaxis in the summer region, not in the winter, right? In this season of the summer, many people have the problem with the nose bleeding because of the higher temperature. What happens? That because of higher temperature, we inhale the hot air, right? When we inhale the hot air, these vessels dilate and can rupture, right? and when they will get rupture, any of these arteries, if they will rupture, they are eventually end up into the Kesselbach's area, right? So this Kesselbach area, it can fill up with the blood. So there can be the bleeding from the nose. So there can be the blood from the nose, right? So there can be the blood from the nose coming out, right? Actually, I am talking about this diagram. Like this, right? So this is the nose, right? This is the nose, and they are doing like this. So this is the Kesselbach area. So this blood can come out from the nose, right? We can have two kinds of epistasis. We can have the anterior epistasis and the posterior epistasis. So if there is anterior epistasis, the blood will come out from the nose, right? If there is the posterior epistasis, it can flow into the esophagus down, right? And in some cases, aspiration can occur, right? If the blood will go into the trachea, right? If the blood will go into the trachea and through that it will goes into the lungs, then it can cause the pulmonary edema and various other complications, right? Like the aspiration, right? So the patient will not be able to inhale, will not be able to breathe properly, right? That can be the fatal condition for the patient, right? So epistasis we can have two kinds, right? Anterior one and the posterior one, and the more dangerous is the posterior one. In the posterior one, the blood will come out from the nostrils also and goes back into the esophagus or the trachea in some cases and can cause the aspiration like that problems, right? So the posterior epistasis is more dangerous as compared to the anterior one, right? So the Kesselbach's area, you have to remember about the Kesselbach's area because this is very important in case of the epistasis, right? About the management, how to treat this epistasis, we can put the ice pack over the bony part of the nose, because the nose is divided into two parts, right? We have the bony part and the cartilage part, right? So up to here for example, we have the bony part, and this part is made up of the cartilage. So this part is made up of the cartilage, right? So in the bony part, the person, whoever is suffering from the epistasis, have the bleeding, right? Anybody can have the bleeding. This is not any kind of pathological conditions, right? Whenever we inhale the hot air, this can happen because of the vasodilation of these kind of arteries, right? Because they are the bunch of arteries ending up into this area, Kesselbach area. And whenever there is the blood, it can flow down through the nostrils outside, right? So in that case, we have the anterior epistasis, right? There are more cases of the anterior epistasis as it is more common as compared to the posterior epistasis, right? So in this situation, the patient should be asked to close the bony part of the nose for about 15 to 20 minutes or until the blood stops, right? So we are closing that Kesselbach's area actually at that moment, but we should not close the anterior part, that is the cartilage part, right? Because Kesselbach's area is present near about the bony part, right? Inside it, like this, not in the cartilaginous portion. So further we can give the vasodilators. Vasodilators can also help in these situations, right? So this was about the nose, some points about the nasal cavities and the sinuses, the inflammations of the sinuses and what can be the complications of the sinuses, and the blood supply of the nose, blood supply in the nasal cavity, and what can be the complications after the rupturing of those arteries which are forming the Kesselbach's area in the nasal cavity, right? In the nasal cavity, Kesselbach's area is very important as it reminds you about the epistasis, right? So with that, I would like to conclude my video. Thanks for watching this. Thank you.